Aloha, everyone. If you could take your seats, there'll be time for networking after. We are running a little bit behind, so my time is basically up already. So I will speed through the 29 slides I have in 3 minutes, closer to 10, actually. Reminder that the food will be out there after as well, and you're welcome to stand outside to have a snack. But I'd like to welcome you folks to the 2024 annual meeting for the Hawaii Public Health Association. And thank you. I'm going to go through the report to our members pretty quickly so that we can get onto the program. No one wants to see that. First, I really want to thank our sponsors. We could not have held this event, or a lot of what we do can't be done without our sponsors. So mahalo to Mental Health America of Hawaii, Waikiki Health, Aloha Care, Chaminade University, Hawaii Pacific University, University of Hawaii at Manoa Thompson School of Social Work and Public Health, Chamberlain University and Walden University, Hawaii Health Data Warehouse, Hawaii Public Health Institute, Hawaii Public Health Workforce Catalyst Lab, Kaiser Permanente, Kokua Kalihi Valley, and Papa Ola Lokahi. Thank you all for your generous sponsorship. So thank you for those of you who participated in the Hawaii Public Health Association's election and the election yesterday. Our results might be a little bit better than what we saw yesterday for some of us. But thank you for voting, and our incoming new members, our new positions include President-elect Anika Martin, Nicholas Bonifacio as Secretary. Tanaya Jackman will continue as the ARGC, which is the affiliate representative to the General Counsel. Our at-large 1-year Christian Alvarado, at-large 1-year Penelope Dodson. Our neighbor island representative for the next 2 years is Vicky DeMercer. And our other neighbor island for the next 2 years, also Kathleen Hagan. We want to thank the 2024 Board of Directors for the HPHA, especially myself, because I'm the one talking. But we had a really great year, and I'm really excited for what's coming in the upcoming year. So thank you to the executive committee, myself, Alexis Charpentier, Anika Martin, Michelle Tagorda, and Tanaya Jackman. And this here you see the directors, the other board of directors. Here you have our ex-official directors. Thank you so much for your participation in 2024. And we are seeing 3 board members leave us this year due to retirement or other obligations. So Dr. B, I think, is not here, but thank you, Dr. B, for your contribution. Thank you, Katie. I don't think you're here as well. And thank you to Michelle Tagorda. We have new board members. If you're here, if you could just wave your hand or do a dance or throw something or something. Christopher Alvarado, I think it was spelled incorrectly on the previous slide. Apologies for that. Is Christopher here? Dr. Penelope Dodson, she's on a plane right now, so she couldn't join us. She's on her way home. Jake Ryan Sumibkai. Hi, Jake. Nice to meet you. The 2025 Board of Directors, this is the list. I'm not going to read through everyone's names for the sake of time, but these are the board members that you folks will be working with. And the ex-officio members continue on except for Dr. B. We'll get into the board activities. Now the board meets, the meetings are typically held every 2 months throughout the year. We take care of a lot of committee planning during the board meetings and some executive meetings, as well as we have program planning meetings. All HPHA members are encouraged to join our committees. If you wanted to learn more about one of these bulleted committees, please reach out to Holly. That's her email right there. And also, I want to point Holly out. She's a little shy and tends to hide, but she's our executive director, and she's going to be the one that looks stressed. Our membership report, we have a total of 410 active members right now. Our new members in 2024, we had 24 regular board members join, 28 student members, 2 senior members, and 2 additional lifetime members. Member benefits, the types of communications that you can expect is a weekly e-blast. It's usually on a Monday, twice yearly newsletters, and of course, resources on the website, member portal, and we have a presence on Facebook, Instagram, and Twitter, which is now X. These are our lifetime members. I'm going to read every single name. I'm just kidding, I won't. But these are our wonderful committed lifetime members. We're up to 85 as of this year. The different membership levels that we have, the regular membership is $50 for a year. Students at any of the local colleges or universities can have their first year of membership covered for free, and it's just $20 each year after that. We have a senior level at $20, and the lifetime membership is $300. We have a lot of organizational memberships currently, and these are the different levels of organizational membership. Each organization receives their logo and link on Hawaii Public Health Association's website, organization's logo on HPHA Communications, recognition at the annual meeting, which you're here at today, and then individual HPHA memberships for staff, and it's a tiered, depending on the level, there's a different amount of for employees of that organizational sponsor. And these are our current organizational members: Mental Health America of Hawaii, UHA Health Insurance. They are our Miley members. Hibiscus level is Chaminade University, Hawaii Pacific University, Parents and Children Together, University of Hawaii at Manoa Thompson School, Social Work and Public Health, University of Hawaii at West Oahu, Waikiki Health. I just saw Waikiki Health walk in. Chamberlain University, Walden University, Hawaii Public Health Institute, Hawaii Young Healthcare Professionals, HAPA, which is the Hawaii Academy of Physicians Assistants, HMSA, Papa Ololakahi are our plumeria level members. So the programs committee report is very brief. We hold 2 events each year, this one and an event during the National Public Health Week, which is in April. Both events draw over 100 attendees at each, and there are also the 2 events that HPHA depends on a big source of their revenue from. So we do that by soliciting sponsorships, some ticket sales, and we try to keep the ticket sales as low as possible so that cost is not a barrier. A couple of years ago, we started a student fellows program, and we have 2 students a year, a spring student and a fall student. They each get $500 for their fellowship, and it's a semester-long fellowship, and they get a mentor. One of the board members are a mentor to that intern, and they spend the time with us, and they get to learn about community board service, policy, advocacy, planning. This year we had Grace Caruso, who I don't think is here, but might be coming, and you might meet her later. And then earlier we had Taina Yanagi. Our fund development report, we had an increase in organizational memberships in 2024, which is great. We pursue sponsorships for our events, which generates organizational revenue. At the current time, as of October 31st, our primary bank account, our operating bank account, had just over $48,000 in it, and we don't have any the association has no liabilities whatsoever. This is the treasurer's report, and I'm sorry, usually these respective people would come up and present, but they're not here, so I'll kind of go through this really quickly. You'll see that between October 2023 and September 2024, we had just under $45,000 in total income. Our total expenses were just over $38,000, so we had a net ordinary income of just under $6,000. The Committee on Legislative and Government Relations, which is myself and Holly, which means it was Holly, basically, as you know, for those of you who have actually worked in policy, it was a really weird legislative session. And I don't mean weird in a negative way, I just mean that there were so many priorities targeting the Maui fires and the response to the Maui fires and the victims who were indirectly and directly affected by the Maui fires. So we did submit 29 testimonies for 12 bills. 2 measures did pass, House Bill 1774 and Senate Bill 2305, which is relating to missing persons Silver Alert program. This came out of the Alzheimer's Association of Hawaii. SB 3122 relating to public health standards, standing orders which authorizes the Director of Health to issue public health standing orders for patients to self-refer to certain healthcare screening services. If any of you are interested in policy, please check with Holly because it's the one committee that no one wants to be on. But it's really exciting, I promise. And Holly will do all the work. The marketing committee basically does a lot of the graphic designs, promotion of programs, promotion of events. The committee also advises on graphic design for events and programs. I'm gonna ask Tanaya, who is our affiliate representative to the General Counsel, to give her report.
Thank you, Brian. So HPHA just ended a week ago. I know that some of you were there, and it was held in Minneapolis, Minnesota for the governing council over 5 days. And there were many people. I think they told us about 12,000 attendees this year. The theme was rebuilding trust in public health and science, which is obviously a huge challenge and an even greater challenge now today. So there were many sessions. They did it digitally and in person, but there were all kinds of public health policy, what's going on in states with more restrictive laws, reproductive health, mental health, health equity, many things. So for those of you who did attend, there's still access through the end of the year for those. And shortly, we're going to be having a presentation from Deanna Wathington, the new president as of like a week ago. And the governing board elected Nandi Marshall to be the next president starting in a year. And a year from now, the public health meeting will be in Washington, D.C. Very interesting. And National Public Health Week will be April 7th to 13th. And we will be having another event then and look forward to you engaging with us throughout the year. So thank you very much.
Thank you, Tanaya. So this is another opportunity, I'm told, to beg for you to join a committee. Reach out to Holly. You can also get information on the different committees at hawaiipublichealth.org. I'm going to read the incoming HPHA president's bio, Dr. Deanna Wathington, and then there'll be a short video, and then Grace will be coming up, I believe. Dr. Deanna J. Wathington brings over 25 years of practice and academic experience in the field with emphasis on collaboration across multiple sectors to address and optimize community health. She currently serves as clinical director at Reach Up Incorporated and has an affiliate professor in the College of Public Health at University of South Florida. She previously served as Dean of the College of Health Sciences at Bethune-Cookman University, Associate Dean for Academic and Student Affairs for USF College of Public Health, Associate Dean for Academic Enrichment at USF College of Medicine, and as the Director of the Office of Minority Health for Florida Department of Health. Dr. Wathington has served on a number of national regional committees and currently serves on the Council on Education for Public Health and advocates for highway and auto safety as an HPHA representative. She also serves on the ASPPH Workforce Advisory Committee and as an executive director of the Consortium of African American Public Health Programs. Previous service includes the National Partnership for Women and Families Listening to Mothers Advisory Group, the National Academies Sciences, Engineering, and Medicine Committee on Progress Toward Human Health and Community Resilience in the Gulf of Mexico region, the U.S. Department of Health and Human Services NPA Region 4 Southeastern Health Equity Council, and as chair of the executive board of the American Public Health Association. Dr. Wathington earned her medical degree from the University of Medicine and Dentistry of New Jersey Medical School, now known as Rutgers University, Master of Public Health from Temple University, a baccalaureate in zoology and physiology from Rutgers University. She completed residency training in family medicine at JFK Medical Center, New Jersey, and Bayfront Medical Center, Florida. She was awarded the distinction of Fellow of the American Academy of Family Physicians. She sent us a video, which I will play for you now.
Hi, everyone. My name is Grace Sophia Caruso. I am a student at Hawaii Pacific University. I was accepted into their public health graduate program at the beginning of this year, and I'm honored to be HPHA's Fall Student Fellowship. A little bit of background about me. I grew up in California and I went to college at St. Martin's University. I double majored in theater arts and psychology with a focus on directing and cultural psychology. Once I graduated, I moved to China and I became a theater teacher and a curriculum developer. When I moved back to the United States, I decided that I wanted to have a career that aligned more with my core values. So that's why I decided to study public health. Right now, I'm working on my capstone, which is on simulation training on the signs of human trafficking. I'm just in my preliminary research, so if any of you guys have any information on simulation training or human trafficking, please find me. I would love to talk to you. All right, so now I'm going to introduce our speakers today. So we have Scott Stenrud. He is a dedicated public health advocate with a deep commitment to creating space that allows youth to advocate on issues they are passionate about. His work focuses on mentoring youth and fostering youth leadership so that they may drive initiatives that aim to create a healthier, nicotine-free future for the next generation. He has been with Hawaii Public Health Institute as the statewide youth coordinator under the Coalition for a Tobacco-Free Hawaii for the past 6 years. Next, we have Matt Strombach. They are a 16-year-old and currently attending Punahou School. In 2022, he opened Spill the Tea Cafe with his mom. Spill the Tea Cafe is a nonprofit mental health clinic with the goal of creating accessible mental health services to Hawaii adolescents. Last, we have Joshua Durang. As a 16 years in HIV service field, ranging from HIV testing and prevention education to behavior research and client service, he got his start volunteering for a social educational program focusing on male sexual health, and quickly found his passion for promoting health and wellness within his community. Josh transitioned from his work in HIV prevention to serving those living with HIV when he moved from his home state of New Mexico to Denver, Colorado. While in Denver, Josh provided critical services to his client through the food bank, financial services, medical case management, and housing subsidies support. He moved to Honolulu in spring 2023 and is excited to be a part of the HHHRC team, bringing harm reduction services to participants utilizing the syringe exchange program. The work of Josh and his team offers a unique opportunity to be a bright spot in the lives of those they serve. Thank you.
Okay, hello everyone. My name is Amanda. I am the HPHA, one of the board directors. And I'm also program co-chair for the programs committee. I'm super excited to have our speakers for today. And I will also be helping to moderate the Q&A. We're running, a little bit behind as always with these programs. So we'll probably only have time for 1 to 2 questions, but our first speaker is going to be Scott. So I'd like to invite Scott up.
Thank you. Most of my job is to not be out in the front. It's to make sure that sorry, I'm also not very good. I like to walk around when I talk. So can I hold this thing? Okay. I don't like to be standing behind a podium. I like to be in the back of the room while the youth like Matt are up speaking. That's like the whole part of my job is to try to, help youth, not to find their voice because they have their voice, but to make sure that they have opportunities to speak. So the Coalition for Tobacco-Free Hawaii Youth Council is part of the Coalition for Tobacco-Free Hawaii under the Hawaii Public Health Institute. And what we do is we work, the youth work on advocacy. They work on raising awareness and peer-to-peer education. Great, thank you. So we try to get the youth to be willing to speak to other youth. The topic here today was like humanizing, public health, and it's good. Oh, the camera. Okay, so I gotta look this way. All right, so to humanize public health and in science. And part of that is really, working with the youth. Youth speaking to youth is much more effective. So they don't want to hear some old guy like me speaking to them. The youth have, they've got much more credibility. The problem is that oftentimes the youth are not willing to use their social capital to, to speak to youth within their own direct peer group. So instead of peer-to-peer education, it really becomes peer to near peer. So the high school students are very willing to speak with middle school students. Then we can get university students oftentimes to talk to high school students. But usually the high school students don't want to talk to students at their own school. So that's one aspect. Each year, the youth will meet and select a policy priority that they want to work on. So for the past several years, it's been to end the sale of flavored tobacco here in Hawaii. Most recently, they expanded it a little bit to include trying to restore the county's authority to regulate tobacco sales. They haven't had much luck in the last 7 years at the state level. So the idea was if they could help pass legislation along with the support of many of the people here at the city and county of Honolulu, Big Island, Maui, and Kauai, that would then hopefully lead to the legislature to restore that authority if they're not going to do something for the state level. So they work on awareness on these issues in the general public, and also the advocacy aspect, meeting with lawmakers to talk about the issues that impact them the most. So looking at some of the data, and we know that 95% of smokers start before the age of 21. So who better to have speaking about the effects of tobacco than the youth themselves, the people that the industry is targeting. So we know that 1,400 people die every year in Hawaii from a tobacco-related illness, but those people obviously aren't able to come speak for themselves. So try to flip that around a little bit. So how do we do that? How do we communicate that? Nobody really wants to hear too much around facts or figures, right? So we try to talk about that in ways that will resonate with people. So again, humanizing. How do we humanize the science? How do we humanize the data? So using figures, facts and figures that are going to have some type of an emotional connection. So talking about that 8 in 10 youth who use tobacco products started with a tobacco product. Hopefully, people can understand that. They found that when talking about the number of people that die from a tobacco-related illness being at 1,400, that, okay, that's a hard number to really kind of remember or to wrap yourself around. Well, that doesn't sound like that many, 1,400 in the whole state of Hawaii. I mean, it sounds like a lot to me, but to some people, maybe it doesn't. So doing the math, 1,400 people dying every year of a tobacco-related illness, that equates to 21,000 youth that are alive today that will ultimately die from a tobacco-related illness. Now that's much more powerful, right? And we get it back to, well, maybe people don't feel too bad about adults that they think made a decision to smoke, and they forget about, well, when did they start? Started before they were 21. Why did they start? Well, the tobacco industry spends billions of dollars every year marketing their products. And if 95% of your market starts before the age of 21, where are you spending those marketing dollars? It's not the people that are older, right? You're targeting youth. So how could we humanize that? So they came up with a couple of years ago, they wanted to somehow represent that 21,000. Because again, it's like, how do we get people to realize how big that is? And for the youth, when we would go talk, we'd ask them, you know, how big is your school? How many students do you have at your school? And then how many of your schools filled with youth does that equate? But they decided to go with a slipper campaign, and they were trying to collect as many slippers as possible to try to represent that 21,000. So again, trying to humanize the information. Oh, is this not going forward anymore? I don't know what I did. It was going. Oh, let's move to the mouse. Okay, so we're going to try to take that message, at the city and county level, as I mentioned. They were, along with the help of a lot of our coalition members, able to successfully get the city and county of Honolulu to pass a bill to end the sale of flavored tobacco products once that authority is restored. Same thing on the Big Island. So this is a coalition of students from across the state, and we're now working with youth and with council members on Kauai and Maui to do the same thing, to tell their story, because again, they're not going to remember all those facts and figures. So when we are working with them on how to talk to lawmakers, it's just to, don't read off the facts and figures, right? They're not, you would hope that they would be swayed by that. They have all that information, but it's really telling the stories. And that's what we hear from the lawmakers and also people out in the community. But by hearing from you telling their stories, again, it humanizes that and hopefully makes them take action. So that's kind of how we do our work and how we try to humanize public health and in science, by letting the youth tell their stories and sharing that with the public and with the lawmakers. And hopefully that results in positive action around the health disparities that this industry is causing. So I think that is it for me, but thank you very much.
Thank you so much, Scott. So we have a little bit of time for questions. We'd like to take any from the audience. And if you are on Zoom, feel free to drop those in the chat and I can pass them along to Scott.
You work in the prevention of having kids be hooked on nicotine?
Yeah, the peer-to-peer education aspect of it. That's all right, I can talk loud. Hopefully they can still hear me on Zoom. Probably they can't hear me on Zoom. Okay. Yeah, so the peer-to-peer education part. So it's really the youth deciding how they should talk to other youth. They felt, for example, that it was important to, trying to scare them into stopping wasn't the right way, but rather to provide them with the information that they need and then providing them information on where they can get help when they need it. So that was the key to what they were looking for.
So following up to that, I'm pretty sure Hawaii has one of the highest youth nicotine using rates. Do you work in any of the habilitation aspects of youth and nicotine?
We're a cessation area. There's a lot of professionals, out there that do, but we do refer them to services online and text to chat type services that youth can use. So the youth are not trained in that, however. It's more about the awareness and trying to pass policies that will help protect them from the industry.
Do you have data on the reasons why youth start using nicotine?
If you ask the youth, a lot of it, sometimes it's peer pressure. Sometimes it's just, enticing flavors. I mean, there's over 15,000 different flavors. And the nicotine level in these devices is now so high that it doesn't take very many try attempts before they become addicted. So many of the devices that they have are very small, can have up to the equivalent of 30 cartons of nicotine in them. So it's huge amounts. It's not the same as, traditional cigarette where you light it, it's done. They have constant access. So it's about, trying to cope, looking for a coping mechanism. It goes back to the mental health issues, that we hear. But because of the flavors, make it easy to start, and that nicotine then just hooks them for life.
Sorry. So with nicotine, it seems like there's always something new coming up. Something I've heard a lot in my school is Zins. How do you keep up with all of the new things happening?
Yeah, the keep up with all the new things that are happening. Matt mentioned Zyn. Those are nicotine pouches that are also sold in many, many different flavors. You don't notice it because you don't see it. It's just tucked into the cheek. So it's much easier for you to get away with, so to speak. And it is hard to keep up because it's like whack-a-mole. Every time you address one thing, something else pops up. With the flavor ban, we really feel that the youth feel that the flavors are key, because the vast majority, for instance, 97% of youth that are using cigarettes are using a flavored product. If there were not those flavored products, if it was just tobacco flavored, most say they would have never tried it. They would have never started. So if we can eliminate that from all nicotine products, they feel that will break the cycle of addiction.
Thank you so much. We have a round of applause for Scott. Thank you. And then I'm super excited to invite our next speaker up, which is Matt.
Hello. I'm Matt Strombach. I'm the co-founder of Spill the Tea Cafe. My other co-founder is my mother, who is really upset she couldn't make it today. But what does she have? Oh, she's sick with no voice. She's talking to patients all day. Um, so this is our organization. We're Spill the Tea. We are an inclusive mental health clinic. We focus on adolescents, but we take patients of many ages. Our goal is to promote mental health and well-being. So we provide accessible care that and we have really well-trained many different well-trained people to give this care. Um, we have a lot of different personalized care, so we're able to have a diversity of our clients, which include a lot of LGBT youth patients, especially with what's going on right now. Here's some statistics. I'm sorry, I haven't really looked at these slides, so if I seem a little frazzled, that's why. So 50% of all transgender youth attempted suicide in the last year in our state of Hawaii. 60% of LGBT youth who wanted mental health care in the past year were unable to get it. And in 2019, the #1 leading cause of death for Native Americans and other Pacific Islander ages 15 to 24 in Hawaii was suicide. Yeah, that's one we bring up a lot just because it really gets people super shocked. I also wanted to include some statistics from literally today. I don't know if you guys are aware of the election that just happened, but not a great time for people in my community. So according to the Trevor Project, anti-transgender laws have caused up to a 72% increase in suicide attempts in communities of transgender people and non-binary youth. And the LGBTQ crisis line has reported a nearly 200% increase in election-related calls after our new president. Oh, me too. I'm having trouble. The mouse? Oh my God. That's amazing. So our services that we provide include individual and group therapy, family therapy, mentorship, which is kind of what we use as our stepping stone for kids who are unsure if therapy is right for them. We have teen mentors who usually are our interns, right? Yeah, usually our interns, they'll be around the cafe. Um, oh my God, I didn't even like explain the most important part, you guys. So the cafe isn't just a normal mental health clinic. We decided that the reason a lot of teens are so scared of going into therapy is because of the clinical, feeling and aspects of it, walking to a white room with fluorescent lights and being sat down in a weird chair with weird art on the wall. You ever experienced that? Because I have. My parents went through a divorce when I was 8, and I had to go to a therapist for it. And I sat down in the room and I was 8 years old and I was like, this is not the vibe. Like the walls are covered in this weird art that makes me uncomfortable. And she's talking to me like so condescendingly. I hated it. But my mom's a therapist, and we saw this and we are like, we can do better than this. We can make people feel more comfortable. We can make teens want to go to therapy. We can make it fun and interactive and build a community. So what we did is we made Spill the Tea not only a mental health clinic, but a teen hangout spot so that they have friends, they have games, there's a PS5, we have movie nights, karaoke nights, things like that, that just really entice people to not only go there for the clinical aspects, but for a place of safety and a place that makes them feel like they have friends and even family. And then we also have care coordination, which is basically just like, this kid's homeless. We can't really give this kid a space here in the cafe, but we can outsource to a place that we know will make sure that they have a place to sleep for the night and food to eat. Oh my God, another statistic. It takes one supportive adult to decrease the risk of youth suicide by 40%. This has its own slide because it is one of our favorite statistics, because our other statistics we just told you guys were kind of sad. So this one is really, really happy. There's all these statistics for what's going to cause people to commit suicide. Here's what we can do. We can just have one supportive adult, a teacher, a parent, a therapist, a mentor, a friend who's an adult. That's not creepy. And that will decrease a youth wanting to commit suicide by 40%. If we meet Kiki, I meet Kiki, I want to kill myself. There's a 40% less chance that I'm going to want to kill myself because she's there for me now. Things like that. Oh my God. So this is our end. You were holding up signs for me? Oh, I didn't even know that. I was like trying to think in my head how long. Sorry, guys. So here's how you can schedule appointments. It's really, really easy, I think. Donate to us because we are a very new nonprofit. I didn't explain the nonprofit part either. Guys, we are a nonprofit because we will basically get rid of your copay if you can't pay it, which is how we make our mental health services more accessible. That's another big part. Woof, I'm not doing so well. And then here is our social media platforms where you can keep up with my other presentations that are usually more well prepared for. I'm so sorry. I've been busy with theater, which is what I do on the side. And then on our YouTube channel, you can watch Kiki and my mother do podcast stuff. It's really cool. Questions?
Thanks so much, Matt. That was a great presentation, by the way. Where's your cafe located?
Kaka'ako. So if you know where the Whole Foods there is, it's right across. There's this place called Tita Tacos. And if you see that, you'll see a stairwell leading up to us.
I have a question. So thank you so much for your presentation. I thought you did well, given that you didn't see your slides before. Yay! We'll say good things to your mom. Okay, so I'm Caroline Kunitake. I'm the Hawaii Primary Care Office Coordinator, and I promote National Health Service Corps. It's a scholarship and loan repayment program, and I'm curious to know, and these are for licensed clinicians, I'm curious to know how many clinicians are working at the cafe currently?
How many clinicians are working at the cafe currently?
No, thank you for your question. So we have a big team. We have over 30 folks over there. And I believe that maybe like 13, 12 of them are licensed. And then we have some pre-licensed, and then we have the interns.
So then when you say, so one of the requirements for sites to apply for this National Health Service Corps loan repayment, it needs to have like a sliding fee scale. So when you say if a patient's unable to pay, do you offer a sliding fee scale?
Yeah, so one of the things that we do at Spill the Tea Cafe is that we don't turn anyone away regardless of their insurance type or ability to pay. We actually are not able to bill for 30% of our sessions. However, we have amazing partnerships in the community like Mental Health of America. They actually do pay for those patients that we're not able to bill for.
So your licensed clinicians, are these licensed social workers?
They're
psychologists?
LCSW, LMFT, LMHC.
Do any of them have student debt?
Yes.
Okay, so I'm gonna be in touch with you folks. Thank you.
Thank you.
Thank you. Oh my God, sorry, not thank you. Let's keep going.
So I love that you guys highlighted the suicide rates for NHPI, but I'm wondering with targeting outreach, are you guys integrating any culturally informed care methodologies?
Guys, I'm
Sorry.
16. Kiki.
Okay, what was your question again?
So based off of the statistic that you guys highlight for NHPI, the suicide rates being much higher for them, are you guys for outreach? Are you guys integrating any culturally informed trauma care? Or
Yes, we actually have. I don't know if you're familiar with Hilani Shibata. She is our Ho'oponopono practitioner. So we do have a cultural sensitivity, lens around it. Thanks for asking.
Think that's my time. Thank you.
All right. Thank you so much, Matt. I don't know about anyone else. I probably listen to you talk for another hour, but we do have another wonderful speaker to invite up. And that's Joshua.
Aloha, everyone. Matt, I want to give you back your phone real quick. I think that's yours. Yes. I know that I would go crazy if I did not know where my phone was. So, aloha, everyone. Thank you for having me today. I work with Hawaii Health and Harm Reduction Center, often referred to as H3RC. A little bit of background about us, the Hawaii Health and Harm Reduction Center. I have to use my phone because it's super long. The Hawaii Health and Harm Reduction Center serves Hawaii communities by reducing the harm and fighting the stigma of HIV, hepatitis, homelessness, substance use, mental illness, and poverty in our community. We focus our efforts on those disproportionately affected by social determinants of health, including but not limited to people living with and or affected by HIV, hepatitis, substance use, and transgender, LGBTQ, and Native Hawaiian communities. We foster health, wellness, and systemic change in Hawaii and the Pacific through care services, advocacy, training, prevention, education, and capacity building. That's all to say that we are focusing on reducing harm, promoting health, creating wellness, and fighting stigma in Hawaii and the Pacific. Specifically, I'm here to talk to you about naloxone, which is used in opioid overdose prevention, and even furthermore, our initiative around naloxone vending machines around the state of Hawaii. A little bit of history about naloxone distribution amongst the state. H3RC was the main distributor of naloxone for all communities and all community partners. We would distribute these through either in-person trainings, online requests, phone inquiries, through our syringe exchange program, which is my specific program, and our overdose prevention program, as well as mailing out through requests. We distribute between 6,000 and 8,000 doses or kits per year, which is about 16,000 doses per year. Mostly, we used to do this through our mail outs, which created a lot of barriers for folks, created a lot of lag time due to the USPS and their specific regulations on how to mail out bulk items. So we would have to wait for 200 people to request naloxone before we were actually able to send it out in bulk, which became a problem because sometimes people were waiting 2 and 3 months for that to happen. So what we did is we partnered with the Department of Health and the Adult Mental Health Division and the Alcohol and Drug Abuse Division to lower the barriers for people receiving this life-saving medication. For those that don't know, naloxone is the opioid antagonist. So someone who is going through a opioid overdose, naloxone can be administered nasally or through injection, and that instantly reverses that person's overdose symptoms, at least for 15 to 30 minutes, depending on how much substance they'd used. Excuse me, I'm not as quite as prepared as Matt was. I'm very nervous and shaky. So also today, you know, the election and all of that and how that makes us all feel. So so through our community partners across the islands, we have now 30 vending machines on the 5 most populous islands. So Hawaii Island, Maui, Oahu, Kauai, and Molokai. And they are located with various partners, corrections facilities, community health centers, obviously at H3RC, which is actually right down the street. And so, yeah, it's been very interesting to get 30 vending machines delivered to islands and find places for them that are not in the direct sunlight and that are accessible to our communities. Yeah, so I will say that some of the barriers that we had was finding those partners that were willing to house a vending machine, getting those vending machines to them, and stocking those vending machines. Currently, through September 1st of 2023 and through August 31st of 2024, about 6,500 kits of naloxone have been distributed, 15% of those coming from the vending machines. So that seems like a pretty small number right now, but this project is in its infancy, and so we're hoping to grow that in the next couple of years. Some of the concerns that we had when we first started were people emptying the machines. So I should tell you that everything is free. You just hit the number of the, you know, like A3 or D4, and it'll drop a naloxone kit for you. It has information on how to use it, what to look for in an overdose, and how to respond to that with 911. So that, along with getting the word out to the community and getting buy-in from community for overdose prevention, and specifically overdose prevention for the people who are primarily experiencing overdose, has been difficult, but it's something that we continue to work on. As well as some inventory ordering issues that the state has had through other national inventory and ordering issues. So, like I said, where we are right now, we've distributed about 1,000 kits through our vending machines. We're hoping to grow that in the future. We actually have a wait list for more vending machines to be distributed, which is really exciting. We just need to find the funding for that and how to get those vending machines purchased and to those community partners. Again, community buy-in for overdose prevention is probably one of the biggest barriers that we have. Funding obviously is a big issue. Luckily, we have the opioid settlement money, but of course that you know, gets tied up with federal and state and all that bureaucracy. So that's what we're dealing with right now. Obviously, our current political climate specifically the news that we all woke up to today is going to be a significant challenge for us. But we're excited to continue fighting the good fight, saving lives one at a time and getting naloxone into the hands of people who need it. Mahalo.
Thank you so much, Joshua. And thank you to all our speakers as well. I think especially now, right, we're all kind of feeling a little discombobulated and it may be hard to find hope, but I found hope in each and every one of you speakers and the work that you're doing. But are there any questions for Joshua?
Thank you. What didn't the ledge or the city council pass a law that requires establishments serving liquor to have naloxone on the premises?
Yes. So currently, I believe it's Honolulu is the city that has that ordinance or legislation involved. So any establishment serving liquor is required to have at least one dose of naloxone on hand. We do have some wonderful community partners who have put up vending machines in their club establishments. So Scarlet Honolulu in downtown and Hula's Bar and Lay Stand closer to Waikiki have been amazing community partners in helping us get this out. So yeah, we have monthly training, and obviously if people want to request trainings, we can do that on overdose prevention and then offer naloxone to those folks as well.
Hey, okay, so first I want to say thank you for acknowledging what I think we're all feeling today and the reality of what public health professionals are going to have to, increasingly deal with. So first of all, acknowledge and thank you. I'm wondering if you have any results yet on like lives saved from this. And then secondly, I'm wondering how you deal with kind of the anti-public sentiment when it comes to prevention for overdoses.
Yeah, so I currently only have the 2022 data, and it's specifically from our syringe exchange program, and so it's all self-reported. So in 2022 there were 390 overdose reversals that were self-reported. We know that self-reporting often is a very decreased number from the actual what's actually happening. So I would say that number is probably closer to 550. Just anecdotally, but it's nice to know that we have 390 people still alive due to our efforts. And I kind of forgot the second part of your question. Early buy-in. Yeah, so that honestly has been the biggest challenge, I think, specifically for syringe exchange, but also overdose prevention. And really it's trying to humanize people. People are going to do drugs whether you say no or not, or whether you give them the tools to do that safely or not. So making sure that people know that that person who's using could be your auntie, it could be your uncle, it could be your mom, it could be your sister, it could be your child. And so opioid overdose can happen literally to anyone. So humanizing people and focusing on that aspect has made some difference. There are always going to be people that just don't care, which is unfortunate. But that's what this beautiful group of people in this room are here to help fight.
So you've got a lot of vending machines out there, which is great. Have you been able to kind of track and see which ones are getting used more? And then is that driving any other wraparound services and treatment and prevention programs?
So I will say a lot of the inventory issues that we have been seeing are around our correctional facilities that have vending machines. They're often getting emptied very quickly and having issues getting refilled for various reasons. Yeah, so I think sorry, my head I'm like my head is so confused and discombobulated. Do you mind repeating your question one more time? I'm sorry.
Yeah, so you got a lot out there, so if a particular ones are getting used a lot, I was wondering if that's driving any other services geared towards treatment and prevention.
I certainly hope so. Like I said, our project is in the kind of in the infancy. We're about a year into having these vending machines out there. We're actually only about 3 months into having all of them fully out there and stocked. So I think in our phase two, we'll really be looking at who is utilizing more naloxone through the vending machines, what barriers those people might be having, and what other wraparound services that they may be needing at that time.
So my question for that one is because the project is like new, do you guys have like initiative to expand towards like specific concerts? Because I'm a medical volunteer at more so like EDM and raves, and you see a lot of people on drugs and there's no like support just because the way um EMS is set up, it's they're outsourced, so they don't have a lot of their own Narcan on hand. So I was just wondering like
To be honest, I don't know that that's something that we specifically looked at. I will say that anecdotally, we do have a lot of EDM and EDC enthusiasts that work within H3RC. And so that they themselves take a lot of naloxone with them to these events, and are constantly on the lookout for people who may be in distress. But that's definitely something that we can look at in the future, and hopefully, at least for these venues, have a vending machine there. Depending on what that looks like, right? You know, if it's in the middle of the summer and in a big field, it's gonna be a lot harder to have a vending machine there. But it's certainly available, or certainly uh, able to have naloxone available, just maybe not in the capacity that we would really hope for. And I definitely understand your concerns around EMS and their capacity as well.
oh, I just also want to say I actually was able to attain Narcan from Scarlett's, and I actually was able to use it during your thing based off your initiative.
That makes me really happy. Thank you.
I'm part of the Public Health Students Association at Hawaii Pacific University, and I just wanted to ask, you mentioned about the training. Is it only through you, like through, yeah, what is it? Oh, yeah, sorry, only through like your company, or can you come to us and train us at school, like if we wanted to host an event?
We can come to you. Yeah. So Levada Beard Holdner is a CEP or opioid and overdose prevention superstar, and leads those trainings. And she would be more than happy to come out, set something up, and speak to y'all and get y'all trained, as well as provide naloxone if that's something that you guys are looking for.
Yeah.
Thank you so much.
All right, thank you so much, Joshua, and thank you to all the participants as well for asking these amazing questions. Like I said earlier, I think all we can do is focus on what we can do and have control over. So, you know, raising awareness, increasing access to services, and making connections in the community are things that we can do and that we can focus on moving forward. So, I'm super excited to see and hear that happening. So let me. Right, so I would like to invite Alexis up for our closing remarks, but as Alexis makes her way up, we do have some raffle tickets that we will be giving away. So if you have not grabbed your raffle ticket, maybe raise your hand and we can come by and give those to you. There's also plenty food left, and a little bit of time for networking at the end. So just kind of keep in mind that that's there. Oh, there. Like we can say that.
Thank you. Thank you. Thank you all so much. I really enjoyed each of the speakers, all of your presentations. Thank you so much. I too woke up really sad today, and knowing everything that each and every one of you are doing is really important and vitally important for our populations who are going to be affected by the new administration. Sorry. So I'm really grateful and honored to take Brian's place for the next upcoming year to be the president of HPHA. it's important for me, as well as each and every one of you, to do your part to really help these populations that are going to be affected. Yeah, sorry, it's just so real right now. But thank you for all that you do. And I can assure you I'll do everything in my power as president to make sure that the voices are being heard by our LGBTQ and women populations. I also have a fun part of the presentation, which is the raffle tickets. So if you all have that out. Also, I did want to say Holly shared that one of our gifts is for a 21 and older. It's alcohol. So if you happen to be under, sorry, we'll have to pick again. But shall we go ahead? Did everyone get a raffle? If not, we can grab one right now. Thanks, Annika. I'm sorry for my folks on Zoom. They're not able to participate. Okay, there we go. That's fine. Thanks. Thank you, Annika. Okay. Hey, get ready. Okay. I have 218130. Yay. Okay. You want to take it again? I have 218177. Jackie Tley. Yay. Jackie Tley is our director of our PATH Clinic and Youth Outreach Services at Waikiki Health. I have 218142. Yay, congratulations. All right, 218173. Our last two gifts are from HMSA and one of our board members, Vicky. Thank you. 218188. Yay. Hey, we got one more. I'll let Holly pick. 218120. Hi, there we go. Well, I think that's everything on our end, right, Holly? We do have food and refreshments. We would like to ask all the new and all the board members to please come up so we can take a photo. But thank you all so much. Please continue to fight the fight and do all that you can for our people of Hawaii. Thank you guys. Have a good night.